Hi, we are Team 6 and we are determined to improve the dangerously faulty catheters that plague intrathecal therapies for cerebral palsy. I'm Kieran Tremblay.
I'm Lana Neidig.
I'm Emma Smith.
I'm Priscilla Anand.
Let's take a quick look as to why these intrathecal therapies are necessary and determine why the catheters they rely upon need an extensive overhaul. Cerebral palsy is a relatively common disorder affecting 2 out of every 1,000 births. It is a neurological disease that affects a person's ability to balance and locomote and causes excessive spasticity. Modern therapies include baclofen treatment, which can be delivered orally or intrathecally. Intrathecal therapies pump the medication baclofen from an abdomen-implanted pump through a catheter directly into the spine, requiring lower and safer dosages than oral treatments. However, almost 33% of implanted baclofen systems experience catheter failure. These failures lead to the leakage of medication, which can be very dangerous to the patient. Just as a disclaimer, I'm about to show a surgical image. Leakages lead to withdrawal symptoms, unpredicted loss of medication, the return of tremors, and have led to death on multiple occasions. These failures also require costly, extensive surgeries to replace the catheter in full. We can limit these dangerous and costly failures by redesigning these catheters to be more wear-resistant, less modal, and better integrated into the body.
So I will be talking about how we're going to be addressing this need, our approach. So we will be using the concept of bioinductivity, and this would be done through the fabrication of the catheter, both the tubing and the coating of the catheter. The tubing would be silicone elastomer-like and be created via injection molding, and the coating would be made of proteins and growth factors combined and tested in vitro. And these proteins and growth factors would induce ECM creation, growth around the catheter itself. As you can see in this section of the drawing here, the coating with growth factors and proteins is in the orange, and the reds will be the pits that would contain a grain-like structure in order to allow for easier attachment of the cells in the ECM and the surroundings. This is where the catheter would be placed. As you can see in the intrathecal space is on the inside of the spine and where the spinal cord is. And this cross-section of the spine just gives a little bit of a closer look as to what the environment would be.
With this in mind, let's now discuss the costs and benefits associated with this improved method. So this innovative method improves the longevity of the catheter following implantation, and with this, it reduces the need for revisional surgeries, which are costly and invasive. So overall, this improved system would lower the costs of an expensive but necessary treatment. On average, an intrathecal baclofen pump costs around $28,473 in the first year, with most costs linked to the surgery and subsequent hospital stay, with prices decreasing by the second year. On average, intrathecal pumps would cost $8,000 less annually when compared to other treatment methods.
Now let's talk about other alternatives. Alternative solutions include oral delivery and unmodified intrathecal delivery. Oral delivery is a first solution because it's non-invasive. However, it requires a higher dosage because it has to cross the blood-brain barrier. Unmodified intrathecal delivery allows for a lower dosage because it's delivered directly into the cerebral spinal fluid. And however, this requires post-implant surgeries due to pump end of life and complications like catheter migration, and as visualized over here.
And now we're going to discuss who this device would best benefit. This device targets individuals who experience muscle spasticity associated with cerebral palsy that aren't receptive to oral baclofen treatments and or experience major side effects. Specific clients include cerebral palsy patients, their associated caregivers, as well as healthcare professionals who are involved in these procedures all throughout the entire process. And with that, we would like to thank you for listening to our presentation.